There are many strange disorders you didn't know. Some diseases grab the headlines. But thousands of people worldwide suffer from very rare conditions, many of which few people have ever heard of. Few of them are included in our list, the rest of them will be added in the coming videos. Here are 10 of the most unusual and rare medical conditions out there. These are all authentic medical ailments. Welcome to The Amazing Facts. Stay tuned. Top 10 Unusual Illnesses. Subscribe our channel for more videos. Number 10. Strangelove Syndrome or Heart Attack. Strangelove Syndrome, or Florence Syndrome, is a psychosomatic condition involving rapid heartbeat, fainting, confusion, and even hallucinations. Allegedly occurring when individuals become exposed to objects or phenomena of great beauty. The affliction is named after the 19th century French author Stent, pseudonym of Marie-Henri Bale, who described his experience with the phenomenon during his 1817 visit to Florence in his book Naples and Florence, A Journey from Milan to Reggio. When he visited the Basilica of Santa Croce, he was overcome with profound emotion. When I was leaving the Church of the Holy Cross, my heart started beating very fast. I felt like life was drained from me, and I walked with the fear of falling. This is the French writer describing his feelings after visiting Florence. The syndrome was only named in 1979 when it was described by Italian psychiatrist Graziella Magarini, who observed over 100 similar cases among tourists in Florence. Number 9. Walking Corpse Syndrome. If someone told you that the Walking Dead TV series was actually happening in real life, you might not believe them. Walking Corpse Syndrome or Cottage Syndrome is a rare mental disorder in which the affected person holds a delusional belief that they are dead, do not exist, are putrefying, or have lost their blood or internal organs. It usually occurs with severe depression and some psychotic disorders. It can accompany other mental illnesses and neurological conditions. In 1880, the neurologist Jules Cotton described the condition as the delirium of negation, a psychiatric syndrome of varied severity. A mild case is characterized by despair and self-loathing, while a severe case is characterized by intense delusions of negation and chronic psychiatric depression. Number 8. Jumping Frenchmen of Maine. The Jumping Frenchmen of Maine were a group of 19th century lumberjacks who exhibited a rare disorder of unknown origin. The syndrome entails an exaggerated startle reflex which may be described as an uncontrollable jump. Individuals with this condition can exhibit sudden movements in all parts of the body. Most people first experience symptoms right after birth, a condition referred to as stiff baby syndrome. The syndrome can often be effectively treated with benzodiazepines, a drug class used to treat anxiety and seizures by slowing down the nervous system, according to Dr. Hallett. Number 7. Jerusalem Syndrome. Unless you've read comedian Mark Maron's memoir The Jerusalem Syndrome, My Life as Reluctant Messiah, you probably don't know much about this psychological disorder. Jerusalem Syndrome is a group of mental phenomena involving the presence of religiously themed obsessive ideas, delusions, or other psychosis-like experiences that are triggered by a visit to the city of Jerusalem. It is not endemic to one single religion or denomination but has affected Jews, Christians, and Muslims of many different backgrounds. Symptoms may include compulsive cleaning and grooming, wearing white robes, and sermonizing. Sufferers without a pre-existing psychiatric condition typically return to normal within 5 to 7 days, feel some shame about their behavior, and recover completely. Number 6. Dr. Strangelove Syndrome. Officially known as alien hand syndrome, this bizarre neurological illness affects thousands of people. It is caused by damage to certain parts of the brain, and causes one of a person's hands to act independently of the other and of its owner's wishes. For example, the misbehaving hand may do the opposite of what the normal one is doing. If a person is trying to button a shirt with one hand, the other will follow along and undo the buttons. If one hand pulls up trousers, the other will pull them down. Sometimes the hand may become aggressive, pinching, slapping, or punching the patient. In at least one case, it tried to strangle its owner. Says neurologist Rachel Dudy, often a patient will sit on the hand, but eventually it gets loose and starts doing everything again. Number 5. Werewolf disease. Werewolf disease is a rare recessive genetic disorder, with approximately 400 reported cases since its discovery. It was first officially reported in 1929 by Eric Erbach and Camilla Wirth, although cases may be recognized dating back as early as 1908. The symptoms of the disease vary greatly from individual to individual. They may include a hoarse voice, lesions and scarring on the skin, easily damaged skin with poor wound healing, dry, wrinkly skin, and beading of the papules around the eyelids. The patients who have this condition don't have the amygdala in their brains, which means that they are unable to experience fear. There were experiments done on a patient that showed that people affected with this condition are not afraid of snakes, poisonous spiders, horror movies, armed robberies, and other dangers. The only thing that can make them experience something that can remotely be described as fear is the inhalation of a high dose of carbon dioxide, which would make any healthy person panic. Number 4. Algeria. This disease is caused by a build-up silver sediment in the body. As a result, a person's skin has a silverish or bluish color. The development of Algeria happens in situations when people use a lot of products which contain silver, and it is especially common among people who work with this metal. The most well-known person with this disease was an American man named Paul Garrison, who had the nickname Papa Smurf because he looked very similar to the cartoon character. He turned blue after he had been taking colloidal silver for a long time trying to treat his dermatitis. Number 3. Human Werewolf Syndrome. Human werewolf syndrome or hypertrichosis is an abnormal amount of hair growth over the body. The two distinct types of hypertrichosis are generalized hypertrichosis, which occurs over the entire body, and localized hypertrichosis, which is restricted to a certain area. Hypertrichosis can be either congenital or acquired later in life. The excess growth of hair occurs in areas of the skin with the exception of androgen-dependent hair of the pubic area, face, and axillary regions. Most of the time, hypertrichosis is found in men, and rarely in women. Although, the creepy bearded women from the circuses of the past could have been affected with this disorder. Number 2. Fish odor syndrome. Trimethylaminuria, also known as fish odor syndrome, is a rare metabolic disorder that causes a defect in the normal production of an enzyme named flavin-containing monooxygenase 3, that is, FMO3. When FMO3 is not working correctly or if not enough enzyme is produced, the body loses the ability to properly convert trimethylamine from precursor compounds in food digestion into trimethylamine oxide, through a process called N-oxidation. Trimethylamine then builds up and is released in the person's sweat, urine, and breath, giving off a strong fishy odor or strong body odor. The worst thing is that the person may not sense the smell, but other people do. Unfortunately, there are no effective treatment methods, but according to the results of some studies, a special diet together with activated carbon and chlorophyllene can decrease the fish odor. Number 1. Foreign accent syndrome. This rare condition causes people to develop a foreign accent. The disorder is caused by damage to a part of the brain associated with speech.
What's happening to your accent?
Come again? What's this nonsense?
Stroke is the most common cause, but trauma, tumors, and other neurological conditions such as multiple sclerosis may also cause patients to begin speaking with a different accent. The person who has this syndrome can still speak their mother language, but their pronunciation changes so much that other people think that the person speaks with a foreign accent. The disorder itself is not dangerous to the person's health, but people say that they feel alien in their motherlands, and their lives become harder because of the misunderstanding. There are about 60 recorded cases of foreign accent syndrome. Speech therapy may help, but symptoms can last years or become permanent. That's all for this video. Thank you for watching. Subscribe our channel for latest notifications.